It's very aspirational. Maybe moving to you, Tom, because you're in a very different setting, right? So if you think about, maybe first you can tell us a little bit about Nutex Health, kind of your operating models and how you reach out in the society. Maybe start by that.
Yeah, thank you. Thank you, Danaher, for inviting me here. So Nutex Health, we actually deal with two divisions. We have what's called a micro-hospital division, and we have a population health division. And we sort of like mirror the two. I think most of you guys probably have never heard of a micro-hospital. But a micro-hospital is just what it sounds. It's a small hospital. So if you think of a Mayo Hospital, it's a gigantic, maybe 1 million square foot, 1,000-bed hospital. We're the complete opposite. Just think of like the size of a CVS, except with all the bells and whistles of a hospital. So we have an ER, we have 4 to 10 inpatient beds, we have a full lab. And so speaking of lab, our lab is probably about half of this podium here. That's our lab. And then whereas Mayo's lab, I'm sure it's the size of this room, right? Yeah. So Mayo's lab, I'm sure they have a little bigger machines the size of a school bus. And our lab, I mean, school bus cannot fit on this podium, obviously. And so we need things that are small, that are easily operable, and that multiple people could use it, because our hospital run lean. And so at every time of the day, we really have 4 to 6 staff members. We have a doctor, we have 1 to 2 nurses, we have a front desk, and maybe we have 1 to 2 techs to take care of these patients. But even though they're small, they're very popular. I mean, everywhere we put these things, they're patient favorites. People love this model. Think of it as, going back to CVS, think of it as CVS where you could go in, get treated, and go out. And because we're much smaller, we could put these pretty much anywhere, right? And so currently we operate 22 locations in 8 states, and we have another 10 hospitals that are basically in tap to be open in the next 2 years. And that's one of the reasons why we became public. We're traded on Nasdaq now, and that's the reason to become public is to raise capital so that we could grow these hospitals around the country so that we could increase accessibility to patient care.
And I think you and I talked a little bit about this before as well. The way you look at margin versus kind of the mission, you're thinking about it a little bit different sometimes, like even when it comes to reimbursement and things. Maybe you can allude a little bit on that.
Yeah, the way that we think about margin is that, and by the way, our organization is pretty much 100% physician run. So all the leaders are physicians. And so we're gonna do what's best for the patient. And in fact, most of our doctors are investors in our company, either through the public stock or through our real estate side. And so everybody has got a willingness to go the extra mile for the patient, right? And so when we think about diagnostic, it's one of these things where if it works, and if you need it, just get it. And then we'll figure out how to pay for it later. The way that we work is that if there's a test that we like, we just go around the room to a couple guys, and if they like it, we just implement it around all the hospitals. And in fact, we just did that with a company called MeMed, so I'm gonna market MeMed a little bit, even though I have no affiliation with MeMed, other than they're just our vendor. But we just roll them out through all of our hospitals. And one thing is a crowd pleaser because it distinguishes between viral and bacteria, as an example. So the point is that, and I have no idea if we're gonna get paid or not for that test. No idea. Because a lot of the time the insurance company, when they pay what's called bundle rates. So you could order 1 test, or you could order 20 tests. You pay the same, it doesn't matter. And so, we just have to sort of like balance that. But as long as we're a little bit profitable, and as long as the patients are happy, then we're fine with it.
Thanks. So maybe pivoting to you, Mike.